Hi guys, and welcome to our model on the muscles of the upper limb. Now in this model, we're talking about the different muscles found in the different regions of the upper limb. We'll talk about muscles of the shoulder, muscles of the arm, muscles of the forearm, and then muscles found within the hand. There are three major groups of muscles found in the shoulder region. These include the anterior exioappendicular group of muscles, also called the pectoral muscle, the posterior acioappendicular group of muscles, and then finally we have the deltoid group of muscles. For the anterior exioappendicular or pectoral group of muscles, we have four major forms of muscles found there. This includes the pectoralis major muscle, pectoralis minor muscle, the serratus anterior muscle, and the subclavius muscle. Start with the first two group of muscles found there, starting with the pectoralis major muscle. The pectoralis major muscle tends to originate from 2 points. We have the anterior surface of the medial half of the clavicle being the first point. As you can see, this is the anterior surface of the medial part of the clavicle. Usually, we say that the clavicular head of the pectoralis major muscle originates from that point. Hence, the reason why we call the clavicular head in the first place. Then we also have the anterior surface of the sternum being an origin point. So you can see the anterior part of the sternum being serving as a point of origin for this sternal head of the pectoralis major muscle. So the pectoralis major muscle tends to have two heads coming from two separate parts. One is the clavicular head coming from the clavicle, and then the second is the sternal end coming from the sternum. Aside those two major sites, we also have origin points also including the superior six costal cartilages and then the aponeurosis of the external oblique muscles. Those are those extra origin points for the pectoralis major muscle. In terms of insertion, both the clavicular and the sternal head will insert as a single tendon on the lateral lip of the intertubercular sulcus, or what we call the bicipital groove of the humerus. As you can see, both the sternal head and the clavicular head would join together as a single tendon inserting at the humerus and the particularly insert at that lateral lip of the humerus. The pectoralis major muscle tends to be supplied by a combination of the lateral and medial pectoral nerves. And in terms of its movement, it is involved in the movement of flexion at the shoulder joint, abduction, as well as medial rotation. So it helps in flexion, adduction rather, ED deduction, and then medial rotation of the arm at the shoulder joint. The second muscle under the group of anterior extraappendicular muscle would be the pectoralis minor muscle. This muscle originates from the fourth and fifth rib near the costal cartilage. As you can see, this is the third rib, and then below that is the fourth, and below that is the fifth rib. So the origin points of the pectoralis minor muscle. It then runs all the way up to insert at the medial border and superior surface of the coracoid process of the scapula. You can see the coracoid process hanging just below the acromioclavicular joint in this image. The pectoralis minor muscle tends to be supplied by just the medial pectoral nerve, and in terms of its function, it is involved in stabilizing the scapula by drawing it inferiorly and anteriorly against the thorax. The second muscle, or in this particular image, which is the third muscle under the pectoralis group of muscle, includes the serratus anterior muscle in green. This is a muscle that tends to originate from multiple points on the ribs. It originates from the external surface of the lateral part of the first all the way down to the eighth rib. In terms of insertion, it tends to insert at the anterior surface of the medial border of the scapula. That's not necessarily shown here, but you can see how it originates from the first to eighth rib and then runs all the way back to attach to the scapula. So it attaches on that medial border of the anterior surface of the scapula. It is supplied by a special nerve we know as long thoracic nerve. And in terms of its function, it is involved in performing the movement of protraction and rotation of the scapula. Usually, we say that when we want to abduct the at the shoulder joint, the serratus anterior muscle is involved in abduction all the way up to 180 degrees. So remember, the abduction is done by three major muscles: the supraspinatus muscle, the deltoid muscle, and then finally the serratus anterior muscle. Supraspinatus abducts about 15 degrees, the deltoid abducts about 90 degrees, and then the serratus anterior abducts about 180 degrees. And that 180 is that rotation of the scapula that it tends to do. The final muscle under this group is the subclavius muscle, and that's the muscle that is found just beneath the clavicle. The subclavius muscle originates from the junction of the first rib and the first costal cartilage, and then inserts at the inferior surface of the middle third of the clavicle. As you can see, that's the reason why we call it the subclavius, because it's found just beneath the clavicle. In terms of innervation, it has a special nerve innervating it known as the nerve to the subclavius. And then finally, in terms of movement, it helps in anchoring and depressing the clavicle. Let's talk about the posterior axial appendicular group of muscles. This includes five major muscles to note. They are the latissimus dorsi muscle, the trapezius muscle, the rhomboid minor and rhomboid major muscles, and the levator scapula. And all the muscles here are shown in the image down below. Let's start with the latissimus dorsi muscle. The latissimus dorsi muscle tends to originate from three or four major sites. In terms of its origin, it originates from the spinous process of the inferior six thoracic vertebrae, as shown here. You can see it originated from the spinous process of the thoracic vertebrae all the way down from the inferior six thoracic vertebrae. It also has its point of origin from the thoracolumbar fascia, which is this fascia shown here. This is thoracolumbar fascia, and also a portion of it originates from the iliac crest. You can see a part of it coming from the iliac crest. This is the iliac crest at this point. And then finally, it has some form of origin from the inferior three to four ribs. That's not shown here because it's covering the ribs, but the lower third to fourth rib, that's the 12th, the 11th, the 10th, and the ninth rib all serve as origin point for the latissimus dorsi. Aside that, it tends to insert all the way at the floor of the intertubercular sulcus of the humerus. So it runs all the way to the humerus as shown here. And where it inserts at the humerus is just the floor of the intertubercular sulcus, or what we know as the bicipital groove of the humerus. It is supplied by the thoracolumbar nerve, and in terms of its function, the latissimus dorsi muscle is involved in the action of extension of the shoulder joint, adduction, adduction, and then medial rotation of the arm. The muscle just directly above the latissimus dorsi muscle is the trapezius muscle. This muscle has multiple points of origin as well. They originate from the medial third of the superior nuchal line, and that's shown here. So this is superior nuchal line. So the medial third of the superior nuchal line serves as origin point. It also originates from the spinous processes of the seventh cervical vertebrae down to the 12th thoracic vertebrae. You can see how it starts from the seventh cervical vertebrae and runs down to the 12th thoracic vertebrae. And then it has some form of origin from the external occipital protuberance. This is the external occipital protuberance here. And then the nuchal ligaments. This is the nuchal ligament. So nuchal ligaments and superior nuchal line. Then the spinous process of the seventh cervical vertebrae down to the 12th thoracic vertebrae. These are the origin points for the trapezius muscle. It also extends a little bit to the front, although not shown here, but it extends to the front and also has some attachments to or insertions to the clavicle and the scapula. So at the front, it tends to insert at the lateral third of the clavicle and then the acromion and spine of the scapula. So these are the insertion points of the trapezius. You can see how it inserts at the scapula in this image, and also extending to the clavicle as well in this image. You can see how it inserts at the clavicle in the image, as I outlined. In terms of innervation, the trapezius muscle is innervated by a cranial nerve. It usually tends to have its innervation coming from the 11th cranial nerve known as the spinal accessory nerve. And then in terms of its function, the trapezius muscle is involved in the function of elevation, depression, and retraction of the scapula. The third muscles under this group is the rhomboid minor and major muscle. I'll just talk about this muscle in groups. The rhomboid minor and major muscles tend to originate from the nuchal ligaments, as also shown here. You can see how they originate from the nuchal ligaments, and then also they originate from the spinous processes of the seventh cervical vertebrae down to the first thoracic vertebrae. So from C7 down to T1, so C7 here down to T1 serves as origin point for the rhomboid minor muscle. The rhomboid major tends to originate from the second thoracic vertebrae down to the fifth. So as rhomboid minor is starting from the nuchal ligament down to the first thoracic vertebrae, the rhomboid major continues from the second thoracic vertebrae down to the fifth thoracic vertebrae in terms of the spinous process. And these are the origin points for the rhomboid minor and rhomboid major muscle. Both of these muscles tend to insert at the medial border of the scapula. The rhomboid minor, for example, inserts at the roots of the spinous process of the scapula at this point. So you can see this is the root of the spinous process of the scapula, whereas the rhomboid major tends to insert at the medial border, the rest of the medial border of the scapula, below the roots of the spinous process. You can see the rhomboid major originating just below the roots at the medial border of the scapula. In terms of innervation, both of these muscles are innervated by the dorsal scapular nerve, and in terms of movement, they're involved in the retraction of the scapula. And finally, we have the levatoscapular muscle, as the muscle here in green. The levatoscapular muscle originates from the posterior tubercle of the transverse processes of the first down to the fourth cervical vertebrae. It inserts at the medial border of the scapula above the root. So you can see as the rhomboid minor insert at the root, the rhomboid major inserts below the root, the levatoscapular inserts above the root, but all on the medial border of the scapula. So both the levatoscapular muscle, the rhomboid minor and rhomboid major are all inserting at the medial border of the scapula, although they are inserting at different points in relation to the roots of the spinous process. The levatoscapular muscle is also innervated by the dorsal scapular nerve, and its movement involves the elevation of the scapula. Let's talk about the deltoid group of muscles. These include muscles like the deltoid muscle, the supraspinatus muscle, the infraspinatus muscle, the teres minor, teres major, and subscapularis muscle. So let's talk about the deltoid muscle and the teres major muscle. The deltoid muscle tends to originate from two major points, one from the scapula, the other from the clavicle. The clavicle, it originates from the lateral one third of the clavicle. On the scapula, it originates from the acromion of the scapula and the lower lip of the crest of the spine of the scapula. It then runs down to insert at the deltoid tuberosity of the humerus. And in terms of innervation, it's innervated by the axillary nerve. And in terms of function, the deltoid muscle is involved in abduction, about 90 degrees abduction, flexion and extension of the arm at the shoulder joint. The teres major muscle just lies below the deltoid muscle, as shown here in yellow. It originates from the dorsal surface of the inferior angle of the scapula. It is found on that lateral border, but inserts largely on the inferior angle of the scapula. It inserts at the medial lip of the intertubercular sulcus. Remember that the pectoralis major muscle inserts at the lateral lip of the intertubercular sulcus. So the teres major just flanks it at the medial lip. So as the pectoralis major inserts at the lateral lip, teres major insert at the medial lip, and then in between them on the floor of the intertubercular sulcus we have the latissimus dorsi, and that brings into remembrance a popular mnemonic known as the lady between two majors. So lady between two majors practically means the latissimus dorsi, that's the lady between two majors, the pectoralis major laterally and the teres major medially. So just try to remember that when thinking about the insertion point for all these muscles. On the lady between two majors, the latissimus dorsi in the middle at the floor of the intertubercular sulcus, the pectoralis major on the lateral lip, and the teres major on the medial lip. In terms of its innervation, the teres major muscle is innervated by the lower subscapular nerve, and in terms of its movement, is involved in the movement or action of abduction, adduction, ADD, and then medial rotation of the arm. Let's talk about the other four muscles under the deltoid group. These are muscles that are collectively known as the rotator cuff muscles. So rotator cuff muscles includes the subscapularis muscle, the supraspinatus muscle, the infraspinatus and teres minor muscle. There's a way in which you can remember this using an acronym. The acronym here stands for SITS. SITS is SITS. S stands for supraspinatus or subscapularis, whatever you want to use. I stands for infraspinatus, T stands for teres minor, then the last S there stands for subscapularis or supraspinatus, however you want to arrange them. So starting with the subscapularis muscle, this is a muscle that originates from the subscapular fossa of the scapula, and that's the anterior surface of the scapula here, muscle shown in green. It then inserts at the lesser tubercle of the humerus. Its innervation comes from the upper, lower, and lower subscapular nerve, and then its movement is in the movement of medial rotation of the arm. And then we have the supraspinatus muscle. That supraspinatus muscle is found in the supraspinous fossa or that is just the fossa above the spine of the scapula. It is innervated by, or it inserts at the greater tubercle of the humerus at this point, and then it is innervated by the suprascapular nerve. It is involved in the function of initiation of abduction. It initiates abduction all the way up to about 15 degrees before the deltoid takes it up to 90 degrees. The third muscle in this group is the infraspinatus muscle. This muscle is going to be originating from the infraspinous fossa, which is just a large fossa depression found below the spine of the scapula at this point. It's also inserted at the greater tubercle of the humerus, just like the supraspinatus muscle. It is innervated also by the suprascapular nerve, and its action tends to be that of lateral rotation of the arm. The last muscle in this group is the teres minor muscle. The teres minor muscle originates from the lateral border of the scapula. It inserts at the greater tubercle of the humerus as well. It is supplied by the axillary nerve and is also involved in the function of lateral rotation of the arm. Let's dive into the muscles of the arm. So there are two major compartments of the arm. We have the anterior compartment and the posterior compartments, and each of these compartments have muscles that tend to flank them, as well as different nerves that tend to innervate the muscles found there. Starting off with the anterior compartment of the arm, the anterior compartment of the arm contains three major muscles. This includes the biceps brachii muscle, the brachialis muscle, and the coracobrachialis muscle. Let's talk about each of them one by one. Starting with the biceps brachii muscle, the reason why we call it biceps brachii is because it has two heads, and each of these heads tend to originate from different points. We have the long head of the biceps brachii originating from the supraglenoid tubercle, as shown here. So this is the supraglenoid tubercle. At this point, it enters in through the shoulder joint to access the supraglenoid tubercle. The short head of the biceps brachii whereas tends to originate from the coracoid process, as shown in the image here. Then both of these muscles will join together to form a single muscle fiber, and then finally insert at the radial tuberosity and bicipital aponeurosis with a single tendon. You can see how they both join together, forming a single tendon, and then that tendon inserts at the radial tuberosity and bicipital aponeurosis. In terms of innervation, it's innervated by the musculocutaneous nerve, just like every other muscle in the anterior compartment. And in terms of action, it performs the action of flexion of the arm, flexion of the forearm rather, at the elbow joint. The next muscle under this group is the brachialis muscle. The brachialis muscle tends to originate from the lower half of the entire anterior surface of the humerus. So it is hidden in the image here, but you can see a portion of it extending below as a muscle here in blue. It's inserted at the ulnar tuberosity, so it's just as the biceps muscle insert at the radial tuberosity, the brachialis muscle insert at the ulnar tuberosity. It is also inhibited by the musculocutaneous nerve, and it's involved in the flexion of the forearm at the elbow joint. The last muscle under this group is the coracobrachialis muscle. That's the muscle here in green. This muscle originates also from the coracoid process of the scapula. You can see both the short head of the biceps and the coracobrachialis muscle both originate from the coracoid process of the scapula. It then inserts at the mid shaft of the humerus, not shown here, but if you could draw the entire humerus, you'll notice that at the middle of the humerus is where the coracobrachialis muscle is inserting at. It is also supplied by the musculocutaneous nerve, and its action is in function of the flexion and adduction of the arm. So although the biceps and the brachialis muscle act at the elbow joints and then work on the forearm, the coracobrachialis muscle tends to act specifically at the arm. The posterior compartment muscles contain two major muscles. The first is the most important one, that's the triceps brachii muscle, and then followed by the second least important, known as the anconeus muscle, although not shown in the image here. The triceps brachii is known as the triceps brachii because it contains three major heads that have different points of origin. So we have the long head of the triceps brachii originated from the infraglenoid tubercle. So just as the long head of the biceps brachii originates from the supraglenoid tubercle, the long head of the triceps originates from the infraglenoid tubercle. Then we have the medial head. The medial head of the triceps brachii originates from the posterior aspect of the humerus. just below the radial groove, and then the lateral head of the triceps brachii is the third head. The lateral head originates from the posterior humerus just above the radial tubercle or radial groove rather. So if I'm to draw a line on the humerus, just behind the on the posterior surface of the humerus, we have a depression known as the radial groove. So that radial groove serves as a partitioning line between the lateral head and the medial head. The lateral head is found above the radial groove. The medial head is found below the radial groove. Both of them are found on the posterior surface of the humerus. In terms of insertion, all the heads of the triceps brachii would insert as a single tendon on the olecranon process. So the olecranon process is found just behind the elbow um, on the back of the ulnar bone, and that serves as an insertion point for the triceps brachii. It is supplied by the radial nerve, just like every other muscle in the posterior compartment of the arm. And in terms of its function, is involved in the extension of the forearm at the elbow joint. The second muscle in the posterior compartment of the arm is the anconeus muscle. It's a very small muscle that tends to be quite insignificant in terms of the function of the posterior compartment of the arm. It begins from the lateral epicondyle of the humerus and inserts at the olecranon, just like the triceps brachii. It is also involved in extension, although it plays a very minor role in the process of extension of the forearm, and it is also supplied by the radial nerve. Let's move on to the muscles of the forearm. The muscles of the forearm are also divided into two major compartment muscles. We have the anterior compartment muscles and the posterior compartment muscles. We'll talk about each of them in the next couple of slides. The anterior compartment muscles can be subdivided into three major groups. We have superficial muscle groups, the intermediate muscle groups, and then the deep muscle groups. For the superficial muscle groups, we have a total of 4 muscles found here. This includes the flexor carpi ulnaris, the palmaris longus muscle, the pronator teres muscle, and the flexor carpi radialis muscle. So, starting with the flexor carpi ulnaris muscle, this has 3 major origin points. It originates from the common flexor tendon found at the medial epicondyle. It also originates from the medial border of the olecranon and the upper two-third of the posterior border of the ulnar bone. The flexor carpi ulnaris tends to insert at the pisiform bone or in the hand, as well as the fucopalmate and then the base of the fifth metacarpal bone. It has or gets its innervation from the ulnar nerve, and it tends to be the only muscle in the anterior compartment that tends to be inserted or innervated by the ulnar nerve exclusively. In terms of its function, it tends to be involved in the flexion of the hand and adduction, adduction of the hand. Then we have the palmaris longus muscle. The palmaris longus muscle is the muscle in blue. This muscle originates also from the medial epicondyle of the humerus, from that common flexor tendon that is shown here. So it's alongside the flexor carpi ulnaris, the palmaris longus also originates from the medial epicondyle, from that common flexor tendon. It inserts all the way down at the hand on the flexor retinaculum, and then its tendon tends to flan out, forming this fibrous band known as the palmar aponeurosis. It's innervated by the median nerve, and then it is involved in the movement of flexion of the hand. Third muscle in this group is the pronator teres muscle. Pronator teres muscle is the muscle in yellow. It originates from the common flexor tendon, just like the other two muscles I mentioned. It also has a bit of origin from the coronoid process of the ulnar bone. It inserts all the way at the mid shaft of the radius, so it tends to flank from the ulnar all the way to the radius running obliquely. And this is very important in terms of its function. It is innervated by the median nerve, and in terms of its function, it's involved in pronation of the forearm. Pronation is the movement or rotatory movement of the radius on the ulnar bone. It's also involved in a bit of flexion of the forearm alongside the pronation in which it tends to do. Then finally, we have the flexor carpi radialis muscle. The flexor carpi radialis also originates from the common flexor tendon. You can see all 4 of these muscles originate from the common flexor tendon at the medial epicondyle. It inserts at the base of the second and third metacarpal bones. It is innervated by the median nerve, so all 3 of the muscles, including flexor carpi radialis, palmaris longus, and pronator teres, are all innervated by median nerve. The exception to that rule is the flexor carpi ulnaris, which is innervated by the ulnar nerve. The flexor carpi radialis muscle is involved in flexion of the hand and abduction, abduction of the hand. So flexor carpi radialis and flexor carpi ulnaris are involved in flexing the hand. Difference between them is that one of them is involved in adducting the hand, that's flexor carpi ulnaris. The other is involved in abducting the hand, abduction, that's flexor carpi radialis. The intermediate group of muscles just has a single muscle in this group. This is the flexor digitorum superficialis muscle. This is a muscle that tends to originate from the common flexor tendon, just like the muscles of the superficial group. It also originates from the medial one-third of the radius. It inserts all the way down to the shaft of the middle phalanges of the second to fifth digits. It is innervated by the median nerve, and it is involved in flexion of the metacarpopharyngeal joints and the proximal interphalangeal joints. Let's jump down to the deep muscles of the anterior compartment of the forearm. These include three major muscles, and these are the flexor pollicis longus muscle, flexor digitorum profundus muscle, and the pronator quadratus muscle. We start with the flexor pollicis muscle. The flexor pollicis longus muscle originates from the anterior surface of the radius. It also has some form of origin from the interosseous membrane. That's the membrane that tends to connect the radius to the ulnar bone. It inserts at the base of the digit of the phalanx of the thumb. Hence the reason why we call it the pollicis longus muscle. Pollicis just means the thumb. So anything pollicis usually would insert or originate from the thumb. So in the case of the flexor pollicis longus, it inserts at the base of the distal phalanx of the thumb. It is supplied by the median nerve and is involved in the flexion of the metacarpopharyngeal joint and the interphalangeal joint of the thumb. Then we have the flexor digitorum profundus muscle. Profundus just means deep, and that's differentiated from the flexor digitorum superficialis muscle, which is found superficial to it. The flexor digitorum profundus muscle tends to originate from the posterior border of the ulnar bone. It also has some form of origin from the proximal to third of the medial border of the ulna, as well as the interosseous membrane. It inserts at the base of the phalanxes or the second to fifth digit, just like the flexor digitorum superficialis muscle. And unlike the flexor digitorum superficialis muscle, it has two forms of innervation. It has one of it coming from the median nerve and the other coming from the other nerve. So in terms of the anterior compartment muscle, two muscles are innervated by the ulnar nerve, and then the rest are innervated by the median nerve. And the two includes the flexor carpi ulnaris muscle, which is exclusively innervated by the ulnar nerve, and then the second includes the flexor digitorum profundus muscle, which is innervated both by the ulnar nerve and the median nerve. In terms of its action, the flexor digitorum profundus muscle is involved in the flexion of the metacarpopharyngeal joint, the proximal interphalangeal joint, and the distal interphalangeal joint. The last muscle under the group of anterior compartment muscles in this deep aspect includes the pronator quadratus muscle. Pronator quadratus muscle tends to originate from the anterior surface of the distal one-fourth of the ulnar bone. It inserts at the anterior surface of the distal one-fourth of the radius. So just like the pronator teres, it spans from the ulna to the radius. So remember that the pronator teres also spans from the ulnar bone down to the radius bone. It crosses obliquely, and the pronator quadratus also tends to cross more horizontally than obliquely. You can see it's in green, starting from the ulna and going all the way to the radius. It is innervated by the median nerve, and in terms of its function, it performs the function of pronation of the forearm, just like the pronator teres muscle. Let's talk about the muscles of the posterior compartment of the forearm. This is also divided into superficial muscle groups and the deep muscle groups. Starting off with the superficial muscle groups, these include muscles like the brachioradialis muscle, the extensor carpi radialis longus, the extensor carpi radialis brevis, the extensor digitorum muscle, and the extensor carpi ulnaris muscle. We'll talk about each of them in this particular aspect of the slide. Starting with the brachioradialis muscle, this muscle originates from the upper to third of the lateral supracondyle ridge, all the way up in the humerus, and then it inserts all the way down at the lateral side of the base of the styloid process of the radius. So it originates from the humerus on the lateral side and inserts at the styloid process of the radius distally at the lateral side. Just like every other posterior compartment, also it is innervated by the radial nerve, and in terms of its movements, it's involved in flexion of the elbow, as well as assisting in pronation and supination at the elbow joint. Let's move to the extensor carpi ulnaris. Extensor carpi ulnaris tends to originate from a single point, just like most of the other muscles we'll talk about, and that point is known as the common extensor tendon. So just like the flexor carpi radialis, flexor carpi ulnaris, flexor digitorum superficialis, and then the pronator teres and palmaris longus all originate from the common flexor tendon. We have the extensor carpi ulnaris also originating from the common extensor tendon alongside some of the other muscles I will mention. Aside the common extensor tendon found at the lateral epicondyle, the extensor carpi ulnaris also originates from the middle one third of the posterior border of the ulnar bone. It inserts at the base of the fifth metacarpal bone. So if you notice the extensor carpi ulnaris shown in purple, it starts all the way up here and then insert all the way at the feet at the base of the fifth metacarpal bone as shown here. So this is the insertion point of the extensor carpi ulnaris. It's innervated by the radial nerve and it's involved in the extension of the hand and adduction. So it extends and adducts a deduction of the hand. So let's talk about the extensor digitorum muscle. Extensor digitorum muscle also originates from the common extensor tendon at the lateral epicondyle of the humerus. It is inserting at the extensor expansion of the second to fifth digits. You can see the extensor digitorum in yellow. You can see how it tends to insert at the second all the way to the fifth digits through the extensor expansion. And then it is innervated by the radial nerve and performs the action of extension of the metacarpopharyngeal joints, the proximal interphalangeal joints, and the distal interphalangeal joints of the second to the fifth digits. It also tends to extend the hand alongside the extensor carpi ulnaris muscle and the extensor carpi radialis muscle. Let's jump to the extensor carpi radialis longus muscle. This is a muscle that originates from the lower one third of the lateral supracondylar ridge. You can see the muscle higher up here in blue. It is originating just directly below the brachioradialis muscle. It inserts at the base of the second metacarpal bone and it is innervated by the radial nerve and performs the action of extension of the hand and abduction of the hand. And then we have the extensor carpi radialis brevis muscle. This muscle tends to originate from the common extensor tendon. So unlike the extensor carpi radialis longus, the extensor carpi radialis brevis originates from the same point where the extensor carpi ulnaris and the extensor digitorum tends to originate from the common extensor tendon. It's inserted at the base of the third metacarpal bone and it is innervated by the radial nerve and helps in extending and abducting the hand. So just like the extensor carpi ulnaris, the extensor carpi radialis longus and brevis also helps in extending the hand. The difference between them is that the extensor carpi ulnaris tends to adduct the hand, a deduction, and then the extensor carpi radialis longus and brevis tends to abduct the hand, abduction. So let's talk about the deep muscles of the posterior compartment of the forearm. These include muscles like the supinator muscle, the adductor pollicis longus muscle, the extensor pollicis longus muscle, the extensor pollicis longus, extensor pollicis brevis muscle, and then the extensor indicis muscle. So quickly, all of these muscles are innervated by the radial nerve, and they all have different functions, origin and insertion, which we'll talk about. Starting with the supinator muscle. Supinator muscle tends to originate from the lateral epicondyle of the humerus. It also spans the supinator crest and the fossa of the ulnar bone alongside the radial collateral and annular ligament. So it has multiple points of origin: the lateral epicondyle of the humerus, the supinator crest, the fossa of the ulnar bone, and the radial collateral and annular ligaments. It has one point of insertion, which is at the proximal one third of the radius, and it is involved in the process of supination of the forearm. Supination is just the reverse of pronation. We pronate by rotating the radius on the ulna. We supinate by putting back the radius in its anatomic position. Then we have the adductor pollicis longus. This is a muscle that originates from the medial one third of the posterior surface of the radius and as well on the interosseous membrane and the mid shaft of the ulnar bone. It inserts at the base of the first metacarpal bone and it tends to perform the action of abduction, abduction of the thumb, the carpometacarpal joints, and extension of the thumb at the carpometacarpal joints. It performs the function of abduction. That is the reason why we call it abductor pollicis in the first place. But it abducts the thumb, and that's why there's pollicis in that particular name. Then we move to the extensor pollicis brevis. This is a muscle that originates from the interosseous membrane and distal radius, as shown in the image. You can see it in orange. It is innervated by the radial nerve, just like every other muscle in the posterior compartment of the forearm, and it is involved in the movement of extension of thumb at the metacarpophalangeal joint. Then we have the extensor pollicis longus. This is a muscle also originating from the interosseous membrane and the mid shaft of the ulnar bone. It inserts at the base of the distal phalanx of the thumb. It is involved in the movement of extension of the thumb at the interphalangeal joints. The last muscle under this posterior compartment group in the deep muscles includes the extensor indicis muscle. It's a muscle that originates from the interosseous membrane and the distal ulna. It inserts with a joint tendon with the extensor digitorum muscle at the extensor expansion. So it's going to be supplying the indicis digit. It is innervated by the radial nerve, just like every other muscle in the posterior compartment, and it is involved in the movement of extension of the indices or extension of the index finger at the metacarpophalangeal joints, the proximal interphalangeal joints, and the distal interphalangeal joints. Let's conclude this module by talking about muscles of the hand. The muscles of the hand predominantly are called intrinsic muscles, and these include muscles like the palmaris brevis muscle, the tinial muscles, the hypotenial muscles, the lumbrical muscles, and the interosseous muscles. Start with the tinial muscles. The tinial muscles of the hand include muscles like the adductor pollicis brevis, flexor pollicis brevis, the opponens pollicis, and the adductor pollicis. All of these muscles tend to be involved in the tend to be found in the tinial eminence of the hand, and they tend to be involved in functions related to the thumb. So the abductor pollicis tend to abduct the thumb, flexor pollicis tend to flex the thumb, the opponens pollicis tend to be involved in the action of opposition of the thumb, which is the ability of using the thumb to touch other aspects of the fingers, and then the adductor pollicis tend to be involved in adducting and abduction of the hand. Now the differences between each of them is the fact that all the first three, that's the abductor pollicis, the flexor pollicis, and the opponens pollicis, are all supplied by the median nerve. The exception tends to be the adductor pollicis. The adductor pollicis is the only tinial muscle supplied by the ulnar nerve. So this is the adductor pollicis muscle, and it's the exception to the rule in terms of the tinial muscles. Remember that the adductor pollicis tend to be supplied by the ulnar nerve. Let's talk about the hypotenial muscles. The hypotenial muscles include muscles like the adductor digiti minimi, the flexor digiti minimi brevis, and the opponens digiti minimi. These muscles are muscles that tend to be found in the hypotenial eminence of the hand, and they are all involved in the function that pertains to the little finger, which is the fifth digit. Hence, the reason why we have digiti minimi in their name. All of these muscles are supplied by the ulnar nerve. So the ulnar nerve supplies the abductor digiti minimi, that's involved in abducting the fifth digit. Flexor digiti minimi involved in flexing the little finger, and then the opponens digiti minimi involved in the function of opposition. Opposition is just the ability of using the fifth digit to touch the other fingers, particularly touching the thumb alongside being able to touch the other fingers. We have a total of 4 lumbricals in the hand. This includes 2 lateral and 2 medial lumbricals. The 2 lateral lumbricals are supplied by the median nerve, and then the 2 medial lumbricals are supplied by the ulnar nerve. These muscles are involved in the flexion of the metacarpophalangeal joints and extension of the proximal interphalangeal joints and the distal interphalangeal joints. The last group of muscles found within the hand are the interosseous muscle. We have proximal and dorsal interosseous muscle, all of which are supplied by the ulnar nerve. The dorsal interosseous muscle is involved in the process of abduction of the digits, and then the palmar interosseous muscle is involved in the function of adduction of the digits. But let's end this module by talking about some clinical significances. This includes the concept of nerve damage, muscle paralysis, and contraction. Usually, when we have a nerve damage occurring in any of the nerves supplying the muscles, what we tend to have at the end of the day will be muscle paralysis. Muscle paralysis tend to usually present as a form of flaccid paralysis when we have damage to nerves that are directly supplying muscles. And these flaccid paralysis tend to also come together or tend to also present together with atrophy of the muscles. So the muscles tend to atrophy, reduce in bulk, reduce in size, and as a result tend to be very weak. Then we have the process of contracture. Contracture is when we have a stiffening of muscle groups. Usually, contracture could come from or as a result of lack of blood supply to a muscle, or usually damage to the nerve, usually coming from the spinal cord or coming from the brain supplying a muscle. So that will lead to stiffening of the muscle, contracture of the muscle, and as a result, the muscle tends to be stuck at contraction. So this is an example of a wasting occurring from a damage to a nerve supplying a muscle. Remember that the median nerves tend to supply muscles of the tinea eminence aside the adductor pollicis. So whenever we have a damage to the median nerve, usually commonly seen in a condition we know as carpal tunnel syndrome, that could lead to atrophy, wasting, and paralysis of muscles of the tinea eminence. So muscles like the abductor pollicis longus, the abductor pollicis brevis rather, the flexor pollicis brevis, and the opponens pollicis tends to be affected. As a result, functions of these muscles are particularly absent. One of the most common inabilities that we tend to see with a damage to the median nerve tends to be inability of the individual to undergo opposition of thumb. And that concludes our module on the muscles of the upper limb.